Hello, my name is Anke Heida and I'm working at the University Medical Center in Groningen in the Netherlands. I'm a medical doctor and I'm doing a PhD right now. And today I present my poster about home versus hospital-based analysis of the fecal marker calprotectin here in Barcelona at the ECCO. So I would like to present a study about the comparison of a home versus a hospital-based analysis of the fecal marker calprotectin. And therefore we asked IBD patients from our hospital to participate in our study if they had a validated phone to perform the IBD measurements. And when a patient wanted to participate, they performed the home measurement with the procedure in figure 1. And secondly, they were asked to collect another stool sample from the same bowel movement and to send in this measurement to our hospital where we performed an ELISA analysis. And what we did is we compared the ELISA measurements with the IBD measurements. We received 152 paired samples in our hospital. And the results are presented over here. The first results are presented in a Blend-Eltman plot. The Blend-Eltman plot presents on the x-axis the mean value of both measurements and on the y-axis the difference between the two measurements. Before the start of the study we reasoned that differences in the lower calprotectin range have a bigger impact compared to differences in the higher calprotectin range. And therefore we defined predefined acceptable limits. For the lower range we used 100 as an acceptable limit, and for the higher range 200 microgram per gram as an acceptable difference. And over here we can see that in the lower range we had 81% agreement, and in the higher range 64% agreement. We also performed a scatter plot. And that's shown over here. We can see all the individual results. And we used our clinically used cutoff values in our hospital over here. And we calculated that the concordance between the two tests was good. It was 71%. And we can see the outliers or the discordant results over here in these three quadrants. I especially want to highlight two discordant results. They are over there. This was a patient which was really impatient, and this patient didn't wait for the feces to dissolve in the extraction fluid. So it was not surprisingly that this patient had a low IBD level and a high ELISA result. Well, in conclusion, we found sufficient agreement between IBD and ELISA test, especially in the lower calprotectin ranges. And we suggest ELISA confirmation if the IBD measurement is elevated or in higher ranges. And we expect that misclassifications can reduce when patients receive face-to-face training from a professional.